This is a piece of legislation that goes to work in phases, and currently there aren't a lot of portions of it that are in effect. But one thing that has not had a lot of publication, and which many of my employer clients are unaware, is that right now employers are required to provide reasonable break time for nursing mothers. If you have someone in your company who is a nursing mother, you have to provide a location where she has the ability to express breast milk for her baby. These breaks don't have to be paid, they can be unpaid, but the statute doesn't provide any guidance at all on what number of breaks per day would be reasonable, or what length of time for the break would be reasonable, nor does it say how long this break program has to continue. There isn't any limitation that mom only gets the break for the first year of the baby's life, or something along those lines. The facility where mothers can express milk, it cannot be in a bathroom, and it has to be a place that is shielded from view and free from intrusion. So that essentially means a locked room where there are either no windows or windows are covered. One of my employer clients said, well, I have more than one nursing mother. Can they all use the same room? And I said, you know, the statute really doesn't say, until somebody tells you differently. If you've met those basic requirements, you probably can do that. But that is something that you need to be aware of. The statute does say that if you have fewer than 50 employees, you may not be covered by this if you can show that it poses an undue hardship for your company, that it's just too much of a burden for you to have your employee leaving her job to go take care of the milk expression. Something else that's coming into effect before some of the rest of these statutory provisions is that restaurant chains who have 20 or more locations have to post nutrition information on their menus. They have to advise you of the calorie content and the nutritional value of the meals you are eating, and have to produce this for each of the food items that they are providing. I've heard some restaurants say that this is kind of burdensome because each time they change an item on their menu, then they have to go through and redo all the nutritional information. And I heard one say it's easier to have 19 locations rather than 20 because of this. Another item that's currently in effect is the Temporary National High Risk Pool. The federal government is setting up a program by which people who have chronic, long-term, difficult illnesses are available to use a high-risk pool. Now, many states like Kansas already had a high-risk pool. We've been doing that for several years, that folks in those predicaments can avail themselves of insurance in a high-risk pool that's shepherded by the state. One of the unintended consequences, I think, of this statute says that before these high-risk folks can get on the new high-risk pool, they have to have been uninsured for 6 months. So somebody who's already been in the Kansas high-risk pool would have to choose to drop that and be uninsured for 6 months before they could take advantage of the federal one. And that's obviously kind of a risky item. So in that context, employers are prohibited from doing anything that would encourage your high-risk employees to move into the state pool. I know lots of employers who say, you know, if you have insurance through your spouse or insurance some other way and you don't use our insurance, I'll pay you X $100 per month and you can go get your insurance there. There's a question now as to whether or not paying that kind of financial incentive for people who don't use your insurance might encourage a high-risk person to move to the pool, and that might be unlawful. We're still waiting for some further guidance on regulations there. But be aware that if you have that plan where you allow employees to go get their insurance elsewhere, and if you're satisfied that they've done that, you will pay them a little bit, you might want to take a look at that, because that could be a problem.
Did you want to share about the tanning tax?
The tanning tax. There is a new tax on indoor tanning.
So we're laughing because those spotlights up there are really bright.
And Clinton's getting a tan.
So I'm getting a tan. So
Free.
I'm worried I'm going to have to either pay tax to the Hyatt or I just get it for free.
If you go for indoor tanning, you'll be subject to a new tax that has to be collected by the tanning provider and submitted to the federal government. There is an exception if you have a note from your doctor that this isn't just for tanning, it's for phototherapy.
And there are a number of other taxes that apply to some of the healthcare sector specifically that we're not going to cover today. I'm not sure I would call indoor tanning healthcare sector, but certainly, medical devices and pharmaceutical companies that aren't in here. If you do have specific questions about those, because maybe they impact you, by all means let us know.